Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
And today we're joined by our colleagues Adam Kegley and Kelly Gavigan to talk about a recent survey we did on the experiences of the LGBTQ plus community in caring for their inflammatory bowel disease. In this talk, we'll dive into the findings, what surprised us, what was confirmed to us, and also, what's next now that we have this data, how to educate our community.
Excellent. Well, let's dive in.
So, Adam, Kelly, welcome to the Health Advocates. Why don't you start by introducing yourselves? Adam, let's start with you.
Sure. Hi, everyone, and hi, Zoe. My name's Adam Kegley, and I'm the Associate Director of Global Partnerships at the Global Healthy Living Foundation. So I help lead a lot of our global-facing work and partnerships with other patient organizations around the world, and also help to lead this project, which is near and dear to my heart, on the experiences of LGBTQ plus people living with inflammatory bowel disease. So it's great to be here and speak about it. Thanks for having me.
Yeah, thanks so much for coming on. And Kelly?
Hello, Zoe and everyone. I'm Kelly Gavigan. I'm the Chief Data and Analytics Officer at the Global Healthy Living Foundation. And I worked with others on the development of the survey that we'll be talking about today and analyzing the data that was captured from the survey participants, many of whom were from our community, and many were also new to us and found us through the survey.
Great. Yeah, I'm excited to dive in. And like you guys mentioned, we're going to talk about the experience of inflammatory bowel disease patients, specifically for the LGBTQ plus community. And before we get started, I figured it'd be a good idea to just do a quick review of IBD, the shorthand, inflammatory bowel disease. I actually live with Crohn's disease, which is one of the two main types. So I feel like I'm probably qualified to give this overview. I'll give you guys a talking break before you dive in. So yeah, basically, inflammatory bowel disease is a chronic autoimmune disease of your digestive tract. The two main types are Crohn's disease and ulcerative colitis. And the difference between those two is that Crohn's can be anywhere from your mouth to your anus. Ulcerative colitis is kept to the large intestine. And the common symptoms of it are diarrhea, loose and bloody stool, loss of appetite, fatigue, fevers. The list can go on, and I'm sure we'll learn more about the symptoms today, but there's a lot of great treatments out there to treat IBD, like biologics. So, I'm in remission. There's a lot of hope for people with IBD. And yeah, I'll turn it over to you guys, specifically Adam. Let's start with what challenges does the LGBTQ plus community face generally in healthcare and also with IBD? What did we know before going into the survey?
Sure. Thanks for that. I think I would say first that LGBTQ plus people, and just to define that really quickly for anybody who's listening, it's lesbian, gay, bisexual, transgender, queer and questioning, and others community. That's what we mean when we say the quote unquote alphabet soup acronym of LGBTQ plus. So I'd say that LGBTQ plus people's experience in healthcare really can depend on whether they have an accepting and understanding healthcare professional or healthcare team who is informed on healthcare related to various non-heterosexual and non-cisgender sexualities and gender identities in their lives. That can really save a patient crucial time at their appointment. That can save them from having to educate their own provider about their own needs, being an LGBTQ plus person or a non-cisgender person, about very specific healthcare matters that might pertain to them. It also, of course, reduces most obviously discrimination in the healthcare setting, either about their sexuality, gender identity, or both, which is probably, I would say, the main challenge LGBTQ plus people might face in healthcare settings, or they possibly can face. That includes either actual or perceived or anticipated discrimination. I wanted to stress that too, because anticipated discrimination can also hinder an LGBTQ plus person from even going to see the doctor because they're nervous that they might be discriminated against. And that's a very real thing that does happen sometimes. It can also impact trusting your healthcare professionals are actually providing you with the best care, or even opening up about issues that might specifically concern you as an LGBTQ plus person, maybe living with a chronic condition like IBD as well. Studies from the health services research have shown that at least 16% of LGBTQ plus people face discrimination actively in healthcare settings. Even things like intake forms being non-inclusive of LGBTQ plus identities, like sexualities and gender identities, could make an LGBTQ plus person feel apprehensive about their appointment and could lead to less personalized treatment or maybe even poorer outcomes for them. Our survey actually found that 1 in 3 LGBTQ plus people living with IBD did not find their doctor's office intake forms inclusive. And I would say with IBD specifically, all those things can come into play, those challenges that I mentioned, like actual or perceived discrimination, and those things can obviously lead to worsened health outcomes like experiencing greater frequency of flare-ups and the symptoms associated with them. And it can also more deeply impact mental health and sexual health and a lot more.
Thank you for that. Yeah, it's hard enough being a chronic illness patient, and it's important to remember like how much your identity and just lived experience plays into that. So Kelly, turning to you, you mentioned you helped in building the survey. Can you talk to us about what the aim of the survey was?
Yeah, absolutely. So we wanted to shed light on the unique challenges that the LGBTQ plus individuals with IBD face, as Adam mentioned, and the specific needs that they have. So we really wanted to better understand certain challenges that arise along the patient journey for LGBTQ plus people with IBD and dive into the emotional and social impacts of living with IBD as a person who is LGBTQ plus.
All right, so let's go in. What were some of the main findings?
So we had about 250 people complete the survey. All of the participants identified as being LGBTQ plus, and nearly 70% were actually between the ages of 18 and 34, which is amazing to have such high engagement among young people. On top of that, about 44% of participants identified as a gender other than cisgender women or cisgender man. So again, we were really thrilled with the variety of representation among the survey participants. And nearly 80% of participants reported using medications as a method for managing their IBD, which is great, but that does mean that more than 20% were not on medication for their IBD. And what's more, most participants reported seeing a gastroenterologist for the care of their IBD, again, which is great and to be expected. But a surprising quarter of participants reported primarily seeing a primary care provider to treat their IBD. And so, that may not seem like a huge deal, but we actually found that the participants who were only seeing a primary care provider were 10 times more likely to not be on medication compared to participants who were seeing a gastroenterologist. And that is a big deal. And unsurprisingly, a quarter of participants reported that their IBD is not very well managed. And then half of the participants reported that their doctor was aware of their sexuality or gender. And among those participants, 2/3 reported that sharing this with their doctor did not affect the care they received, and a quarter reported that it positively affected their care. Notably, 2/3 of respondents reported that there are not enough resources specifically for LGBTQ plus people living with IBD. And we asked, in order to feel more supported in managing their IBD, what did they need? And participants said that they wanted more research on LGBTQ plus IBD populations, more websites with resources, and open communication between LGBTQ plus IBD patients and their healthcare providers.
Adam, I see you nodding a lot, and I want to turn to you and ask what surprised you in what Kelly just talked about.
Yeah, I was nodding quite a bit because Kelly and I have worked really closely on this, and it's all been so interesting to us. I think sometimes the very similar things surprised us, and probably things that we were expecting, they were also confirmed for us, both of us and all the others on the team too. I think one of the most surprising things to me, in which Kelly mentioned, and that was a very positive surprise, was the amount of respondents who identified as a gender other than cisgender man or woman. It was almost 45% of respondents, as Kelly said, and that's really impressive considering that this particular population can be hard to reach and engage in surveys like this or any kind of healthcare related studies. And that's in particular due to some of the challenges that I mentioned earlier, and a lack of trust and an apprehension or perceived discrimination or anticipated discrimination. So I was really pleasantly surprised by that when we discovered it, because I think it gives a real nice depth and breadth to the diversity of respondents actually talking about their experiences and relaying those to us.
For me, I guess I was like positively surprised by that number, Kelly, you mentioned. I think it was 14% that said when they shared their gender identity or sexual preferences that their care was like positively impacted. I feel like so often we're hearing negative statistics, and it was just amazing to hear that, being open and honest with your doctor can lead to more positive experiences for patients.
Yeah, absolutely. And actually, I can even expand on that. For me, I was surprised to know that, among the participants who had not disclosed their sexuality or gender to their provider, half of them had, so the other half, had not. 3/4 of them did not think it would affect the care that they received. But at the same time, nearly 20% of the people who had not disclosed this thought that disclosing this information would negatively affect their care. And that's, much more than the percentage of people who reported having a negative experience after disclosing this information to their doctor. And I think that this really speaks to what Adam was saying earlier about the perceived, effects that it might have on one's care, and likely explains why at least that portion of people, chose not to disclose this information to their doctor. And I think, like I said, there were 3/4 of people did not think it would have an effect on their care. And that is kind of a surprising number, I think. And I think that also explains why they didn't think it was necessary to disclose their sexuality or gender to their provider, because they didn't view it as something that would affect their care either way.
I was just going to say, it makes me think about, when it comes to advocating for yourself, it's so helpful to hear from other advocates and patient experiences. And what you just said is a perfect demonstration on how this survey tells us, like, if we share more patient stories about how it positively impacted care, it can hopefully reduce some of that perceived discrimination that we're talking about, and people could feel more comfortable, like, even taking that first step to advocate for themselves.
I couldn't agree more. And I think just to add on to that really quickly is that with the people who may not have thought that disclosing their sexuality or gender identity would affect the care that they receive, and those that possibly thought that it would negatively affect the care that they receive, there's lots of factors that go into that. But I think the biggest thing is that if you find a provider who's accepting and understanding and informed, studies have shown that definitely it can improve the care that you receive as an LGBTQ plus person, because it's that much more personalized. So I just wanted to throw that out there too.
So building on that a little bit, Adam, what advice do you have for patients who are nervous about being open with their doctor?
It's such a great question, and it's also a tricky one, because it kind of asks, like, how do you tell someone to come out in a healthcare setting when they're unsure it's safe to do so? And for me, and for I think many of us, including us on this recording, of course, we're familiar with the intersections of health outcomes and revealing your gender and sexual identities. And it can be a really crucial conversation to have with your healthcare team, but with the right healthcare team. And so that's the number one thing that I would say is most important, is that it's really important that those conversations take place with someone who makes you feel comfortable, accepted, and understood as an LGBTQ plus person. Trust, or at least the potential for trust, is incredibly important in this particular case. And that's really because all of this isn't just about your IBD or another chronic condition that you might live with. It's really about your IBD within the context of the rest of your life. And I say that with really pertaining to any chronic condition. It's about that chronic condition within the context of the rest of your life. And that includes your sexual orientation and your gender identity, your sexual practices. Maybe you're on hormone replacement therapy, and there could be potential interactions between that and some medications for IBD, for example. And there's a lot more. So really the most important thing is to find that right healthcare professional. And if you live in a less populated area or areas with less options, I'd encourage exploring reviews online, options for telehealth or virtual visits with someone who might better suit you. There are, of course, resources out there that can help you find LGBTQ plus friendly by providers locally, and that includes the Gay and Lesbian Medical Association's provider directory. The National Center for Transgender Equality also has great medical and health-related resources on their site. You could, of course, also ask your LGBTQ plus friends about their doctors and specialists. Are they happy with the care that they receive, and would they recommend them? I know I personally see a doctor who's part of the LGBTQ plus community, and while that's not necessarily needed for everyone, it does make me feel more open and willing to speak about my health and ask questions, because I do feel a bit safer and more comfortable, just a bit more at ease with a provider with whom I can identify in some very specific ways. And I say this regularly nowadays, but I'll say it here again, is that some of your healthcare needs as an LGBTQ plus and or non-cisgender person with IBD are different from those of heterosexual and cisgender persons, and that is perfectly okay and normal, and there should be room for everyone to get the tailored, personalized care that they need.
Thank you for that. Thanks for sharing those tangible tips. I think will be really helpful, especially I know, like you mentioned, if you live in an area with not so many providers. I hear that a lot from our community, so I so appreciate you zeroing in on options for that. So looking ahead, now that we've learned all this, what's next? I'll let Kelly go first.
Sure. Yeah. Thanks, Zoe. I think that I'd really like to build off of what Adam just said, honestly, because I think that a lot of what this survey confirmed is that, people want more information specific to being LGBTQ plus and having IBD. And there are multiple aspects of living with IBD while being a person who is LGBTQ plus that are just not being discussed. And we're doing our part to offer resources for people who are LGBTQ plus and have IBD. But of course, I think that we want people to be able to access resources that come from their doctor if that's what they want. And so I think that requires a lot of building knowledge, and it requires building research and building trust. So I would say those three things are what would come next.
And Adam, turning to you. Yeah.
I couldn't agree more with what Kelly said. And that's exactly what I would say too, is that there's a very clear need from what we had anticipated from our research before doing the survey, was that there was definitely a massive lack of not only research, but resources on this particular community in living with IBD. And I would say that was confirmed for sure by the survey as well, with what respondents said. And we've developed some, and that will continue to work on developing more based on the findings of the survey. And I think overall, just adding on to what Kelly said, because she really summed it up perfectly, is that I'm just really hopeful that people will see these resources as they come out and know that we didn't just do a survey just to do a survey, but we're actually taking action with the results and producing the resources that are tailored specifically for this community, because there's really a great need and a great desire for them. We heard anecdotally in the open response section time and time again very similar responses to what we heard in the actual survey questions themselves, kind of the multiple choice survey question themselves. Why we can't cover everything for every single person individually, I just hope that that will be a really great start in the right direction to really start to change the conversation, or even rather to help start them in some circumstances.
Well, thank you guys both so much for coming on the show, sharing the findings. I think such an important part of doing work like this is also like the dissemination aspect and sharing the results with our community. So I really appreciate both of your time. Thank you.
Thanks so much, Zoe, and thanks for giving us the opportunity to come on here and to talk about all the findings. It's really exciting and very important.
Absolutely. Thanks so much, Zoe, for having us on.
Wow, Zoe, that was a great interview. It's always great hearing from our colleagues.
Absolutely. I was just reminded how important it is to go to the source patients and ask them about their experiences. And it was interesting to learn like what was confirmed for us, what surprised us, and something that surprised me was just how, in a good way, and I mentioned this in the episode, was just how positively patients had of an experience when they were open and honest with their doctor about their gender identity and sexual preferences. How about you? What'd you learn?
Yeah, no, I totally agree. That was really eye-opening for me as well. And I think it goes to the broader point of always being open and honest with your medical professionals and how much that can help. But my big learning from today really is just how the resources that we have at GHLF speaking of folks like Adam and Kelly who can provide information and put out surveys and learn things of importance and spread out into the ether, how valuable that is. But clearly our number one resources are our patients, and the ability that we have to go to our patients and learn from our patients is really a special thing. And it was great.
Absolutely.
Well, we hope that you learned something too. And before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating and write a review, and definitely hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.